Hello, my name is Jing Zhang. Today is March 4th, 2026. Today I will explain several basic medical concepts using one example disease, which is type 2 diabetes mellitus. First, disease. A disease is a normal condition that disrupts normal body function and produce specific signs and symptoms. For example, type 2 diabetes is a disease in which body cannot properly regulate blood glucose levels. Next is disease classification, which is how diseases are grouped based on shared characteristics such as cause, duration, or body system affected. Type 2 diabetes is classified as a chronic non-infectious metabolic disease because it develops over time, is not caused by an infection, and affects the body's metabolism. Now I will explain etiology. Etiology refers to the cause of the disease. The etiology of type 2 diabetes includes insulin resistance, genetic predisposition, obesity, and lifestyle factors such as poor diet and lack of exercise closely relate in pathogenesis, which describes how this disease develops in the body. In type 2 diabetes, the body's cells become resistant to insulin. Over time, the pancreas cannot produce enough insulin to compensate. This leads to elevated blood glucose levels, which then cause damage into blood vessels and organs. That process is pathogenesis. Next are symptoms. Symptoms are subjective experiences reported by the patients. Common symptoms of type 2 diabetes include excessive thirst, frequent urination, fatigue, and blurred vision. In contrast, signs, objective findings that can be observed or measured. In diabetes, signs may include elevated blood glucose levels, slow wound healing, and abnormal laboratory results such as high HbA1c levels. Now I will explain the syndrome. A syndrome is a group of signs and symptoms that occur together. Example related to the diabetes is a metabolic syndrome, which includes high blood pressure, high blood sugar, excessive abdominal fat, and abnormal cholesterol levels occurring together. The next is diagnosis, which is a process of identifying a disease based on history, physical examination, and diagnostic tests. Type 2 diabetes is diagnosed using criteria such as a fast blood glucose level of 126 milligrams per deciliter or higher, an HbA1c of 6.5% or higher, or abdominal or glucose tolerance test. Now let's discuss the complications. Complications are secondary problems that develop as a result of a disease. If diabetes is not well controlled, it can lead to complications such as neuropathy, kidney failure, retinopathy, cardiovascular disease, and stroke. Next is prognosis, which refers to the expected outcome of disease. The prognosis of type 2 diabetes depends on blood sugar control, lifestyle management, and treatment adherence. With proper management, many patients live longer and healthy lives. Without control, serious complications may develop. Finally, diagnostic tests are medical tests used to detect or monitor disease in diabetes. Diagnostic tests including fasting, blood glucose tests, HB1AC testing, oral glucose tolerance tests, and regular monitoring of kidney function and lipid profiles. In summary, I have explained the basic medical concepts of disease definition, classification, etiology, pathogenesis, symptoms, signs, syndrome, diagnosis, complications, and prognosis, and diagnostic tests using type 2 diabetes as example. Thank you.